Well, I am not much of a futurist because I've agreed to speak to the Medicaid directors of America the day of the election. And I think it was kind of a dumb idea because, the election will be hugely consequential for Medicaid. If Mr. Trump is elected president and there is a Republican control of the Senate and House, then I think it's quite conceivable to see one path for Medicaid, which will be, basically cutting coverage. And I don't think the Congressional Budget Office is wrong when they estimate that if the Trump plan were to be implemented, we'd probably see the uninsured go back up again by some 20 million, basically losing all the gains that had happened under Obamacare. So I think that's a likely option if the Trump administration were to prevail. I think if Hillary Clinton is elected president, and there's a chance that if that were true, there would also be a change in the Senate, then I think you could see some action on a number of fronts. One of the fronts would be expanding, you see more states perhaps capitulating and expanding Medicaid, which would be a very significant shift. And I also think there would be a tension, potentially with some bipartisan support, to fix, finally, some of the deficiencies in the structure of the Affordable Care Act with regard to exchanges and how they function and the rules around that. So I'm hopeful that if that were to happen, there might be some positive change with regard to the sort of lingering issues, and that we might finally put Obamacare fights back to the back burner. I tease my Republican friends that the war against Obamacare is now officially longer than America's involvement in World War I and World War II combined, and it just seems to me about time we go over it.